Hi, welcome back to the channel. I'm your host, Lisa.TaylorAustin, and my special guest today is Dr. Anthony Mazzella, a licensed psychoanalyst in New York City. Hi, Dr. Mazzella. Thanks for joining us again.
Hello, Lisa. It's my pleasure to be back. Thank you.
Yeah, your content is so helpful to people listening, and I really appreciate you being here to answer these questions that we have for you about
Mhm.
narcissistic personality disorder and treating people with narcissistic personality disorder.
Yes.
What's interesting is that you mentioned on your podcast that people listening can even think about how to use some of the things that we're talking about here with their spouse or their significant other or their brother, their sister, their coworker who they know or think has narcissistic personality disorder.
Hmm. Yes.
So, in an earlier episode, we were on your channel, the Narcissism Decoder, and we were talking about treating a person with narcissism and how they have many different facets to them. Some are above the surface, things that we see like rage and anger, and some are below the surface, like fear and really having a strong need to belong. And
Hmm.
you were talking about integrating, wanting to integrate those two things together
Yeah.
for the patient.
Yeah.
So, how what does that look like? Do you have examples? Because you were talking earlier about a grandiose narcissist or a more covert type of narcissist. And I'm sure the approach is very different depending on what type of narcissism you're dealing with.
Yeah. So, one of the things I just want to tell all your viewers is what you and I were discussing in terms of integration is the underlying sense of self in any of the personality disorders is what's known as a fragmented self, right? And that's where we often hear this concept splitting. So, in thinking about helping somebody or in terms of healing NPD, one of the things we need to accomplish is integrating. So, if we all agree that they split, naturally we want to help them integrate. So, that's what you and I were discussing in that earlier episode. And what I pointed out is grandiosity, which is one of the most important, the grandiose sense of self, one of the most important structures of NPD. The structure that holds them together is not just the presentation of like the shiny boots, the arrogance, and the glittering, right? That's what we were talking about, that the vulnerability, right? All the other softer things that go on, they they um they interact dynamically. In other words, they're both there simultaneously, right? It's just one is higher, like you see more of one, the grandiosity, and then you see less of the vulnerability. But that switches. It always switches. And
Yes.
then you see more of the vulnerability, but they're both always there in a reciprocal relationship. That's what I was trying to emphasize in that earlier one. And I just wanted to sort of orient your viewers to that.
Yeah, I think of it in my mind kind of like an iceberg, and you have the water and you can see what's above the water, but you can't see what's below the water. But it's all
Mhm.
part of the iceberg. That's how I like to kind of visualize it in my
Okay.
mind.
Okay, but I just want to add one thing to your metaphor, if I may. You
Yes.
have to think about it like an iceberg that, for whatever reason, keeps flipping over. Okay.
Ah, yes,
Right?
true.
Because if you pay close enough attention, and that's in the example that I gave a little bit earlier, and I'm going to give some more examples so it's really clear to the people who are watching this, that it always flips over. So that iceberg, maybe most of the time you see the grandiosity, but if you pay close enough attention or you get close enough to these people in your life, you will absolutely see the vulnerability. And that's really important because when you see the vulnerability, it makes it a lot easier to relate to somebody like this rather than just get angry at them because they're angry at you or at the kids or something like that, or at a phone call that they got. That's what we were talking about. An example of a fellow who got a phone call at work to do something which was part of his job, and he flew into a rage. So Lisa and I were discussing how, first of all, we treat the rage like a smokescreen. So from a psychodynamic perspective, the rage is the manifest content. And in terms of getting close to these people, or me working with them in therapy, is the first act, and I'm not going to discuss it here. I keep promising Lisa or anybody who's listening, is the act of containment. That's the foundation, because if someone is overtaken by an affect storm, you have to help the storm calm down and get them in a more reflective state of mind. So we're already assuming, Lisa, so we're pressing forward because we want to go on to different tools and techniques, but we're assuming already that somebody is already in that more regulated state of mind, if that's fair to say, because that's number one. And then number two is the question that Lisa just mentioned, which is then once they're regulated and they're in a more reflective state, how do we help them begin to integrate? Right. So that's where we are. Is that okay, Lisa? Did I just, okay.
Yes,
So,
thanks for bringing us up to speed.
okay, good. So if we just use that example, and all of you could just think about this in terms of what's relevant to you, but basically it's someone makes a request of somebody, maybe a partner in your life, maybe you make a request of a partner in your life, and they become enraged with you. It's like, what do I do with this? How do you handle something like that? So in terms of the intervention, it's always a safe place. I found it's always a safe place to start with something like, it seems like that response, whatever that response is, whether it's the arrogance or the anger, feels very important to you in the moment. And that's what I said to this fellow, by the way, when he came into session, enraged about a request that was made of him at work. Or again, depending on where the person is, in other words, if they can hear you and they begin to calm down, then you can use a different intervention that may look something like this. I can see that that is a very important response for you. So you're still acknowledging it's important to them to behave in this way, right? We just don't know what purpose that anger serves. Do you have any thoughts about that? So Lisa, you may have noticed I added just a little something there, right? So I'm not just describing or appreciating, let me say, that this is important to you, but now I'm trying to engage their curiosity by saying, we just don't know why it's so important, right? Hopefully that engages their curiosity. Or if we want to go a step further, in that earlier episode, you mentioned fear as maybe the underlying thing that drives the anger. And I
Yeah,
said, yeah, go ahead. Yeah.
and
Mhm.
narcissists don't articulate that, and they won't exactly show it, but that's really the underlying emotion that I think spawns a lot of this other types of behavior.
Yes, fear, shame. In
Mhm.
this case that we were looking at, the fear of being alone with that request to do the work, because it stirred up a childhood feeling of being alone and not recognized and feeling nobody was there for him. Um, so in that case, if you've done a little bit of this work already with them, or you feel they're in a receptive state of mind, you could start filling in those words. You can do that. And you have to be very careful and be prepared, because what might happen is, if they're not ready for that yet, because the whole point of the anger is to not deal with that, they may push it away. And if they push it away, don't get angry with them. Don't call them resistant. Don't say that they're never going to change. Recognize that they're not ready for that, or you pushed it a little too far, right? So another intervention can be like, I wonder if finding something to criticize your colleagues or your boss, like in this example with this fellow, right? I wonder if that gave you a little bit of distance from how exposed. See, or anxious, right? I could put the word in there now. You
Yeah.
felt about getting this project. See, now I'm introducing something new. And this seems so simple, right? Like so basic. But for someone who doesn't really have a capacity to have two people in the room, remember, the narcissist is, it's all about me. This is asking a lot, because now you're giving a perspective that's different than their perspective. So you're expecting a lot of them, okay? But anyway, again, if they're close enough, you can add in. So I'm just giving different levels of the way you could talk, just from basically describing and recognizing the anger, to then getting them to be curious, but we don't know why that is, to finally, it's like, maybe you were angry to get a little distance from feeling, like in this case, all alone with the project. So you attacked your boss, or your colleague in order to not have to think about that. I don't know. Does that make sense a little bit, Lisa, or like where are we with that?
Yeah, it does. Um,
Mhm.
I'm thinking that, sometimes people with NPD are willing to accept what you're saying. I think if they feel as though you're saying it with care, and also, as you stated, that trust has already been established.
Yes, if the trust, yes, that's the big thing. Because if not, they won't see it as like you're talking to them with care. Like they may actually say, "This seems so strange," but they may say something like, "I see that you care and you're trying to help me, but you're doing that for your own selfish reasons. You're doing that so you could feel good about yourself." Like, and they really believe that because they've been so exploited their whole life, probably by a selfish caregiver who really did have a motive like that.
Mhm, mhm. So, do you see progression with people in treatment with NPD? Or do you find that people come and they come for a few sessions and then stop? What do you notice as kind of like therapeutic challenges and breakthroughs?
So, like anything, it's like a mixed bag, right? Because some people come because someone is so fed up with them. Maybe they had an affair, maybe they were abusive towards the kids, and their daughter is sending them to therapy. And it depends on the extent to which you can engage them, right? Because it's not uncommon to get these referrals, but if you can engage their curiosity in the way that I was just describing a moment ago, usually the prognosis is a little bit better, right? If there's some general awareness, Lisa, that they've contributed to the problem and it's not like their daughter just over exaggerating or their wife is being dramatic, for instance, usually the prognosis is a little bit better. So there are certain indicators, I would say, that will really help determine how well this will go. And in terms of helping them, I love to show you by way of example, if that's okay, because I love examples. And then you
Yes,
could be the judge, okay? You and your audience could be the judge if you think that this kind of stuff could be helpful to somebody, okay?
sure.
So
Let's hear it.
so here's another common one that I think many people could probably resonate with. Let's say someone comes in and they're really upset because they text their girlfriend or boyfriend or they had a dinner date plan and someone didn't get back to them, right? Or someone didn't respond to the text quickly enough, or they were left waiting at the diner or the restaurant, because the husband or somebody had to work late. So how do they come in? They come in what? Feeling upset, feeling enraged, and probably blaming the other person. Okay. So in this example, this fellow comes in, let's say, hypothetical patient as always, and
Mhm.
says, I text my girlfriend and she didn't text me back. Or she's slowing down her responses. They're not immediate, like in our world, like we love immediate gratification. It feels so good. So what I could do is then, rather than challenge this belief head on that his girlfriend is not interested in him anymore, right? I might say something like this to him. It sounds like you're feeling anxious. Again, I'm just doing some review, Lisa.
Yes.
Period. That's it. Period. Right? Nothing more at that moment because this is a process. We have to see how they respond. Or it sounds of course it's disappointing. That's the whole validating and containing. But then if you have their attention, I may add something like, you're feeling anxious and not important enough for her to return your messages more quickly. You see, you got it. I added that piece. Not important. That didn't come from him. But again, this is when there's the trust and there's some working and there's some curiosity. And then so you can put that in. That what you're really getting at is that more vulnerable side now. You see, he's not just angry, but he's feeling like he's not important. And then I would say, can we pause and think about whether there might be another reason that she's not responded? So in that moment, I'm helping him shift from certainty to curiosity. I'm
Mm,
starting to see, or I'm trying to help him see that this is one way to see it. This is one version of reality that she didn't respond and maybe the relationship is over, right? But there could be another reason. Now, this is really hard for people again who have personality disorders or these characteristics because this actually, Lisa, is part of the grandiosity, believe it or not, that they know they have a thought and they know it's true. So just in that, is it possible that there are other reasons? This is the beginning of what we call mentalization, starting to reflect on one's own and others' inner states. So,
Okay, very good, very
okay.
helpful. Um, what signs do you look for that suggest a client with NPD or narcissistic traits is making meaningful therapeutic process?
So,
Progress,
yeah.
progress.
So
Yeah,
in
you
that,
make sure
yeah,
they're progressing.
yeah. So in that moment, what I would look for, if I know progress is happening, is not the same old response that one typically would hear from somebody who's more fragile, which is, what do you mean other ways to think about it? Or how dare you suggest there's another way? See, now we have to go back to the act of containment, you see? So we're not progressing, we're moving backwards. So sometimes people come in and they say, how long will this take? And I say, these things are hard to predict because I don't know at what pace you're going to move. In other words, I may say things and we establish something, but then you come back next week and you get upset with me because I said something that was very, you know what I mean?
Yes.
So progress then is that they demonstrate a curiosity. Progress, and that is progress. I'm sorry for anybody who's listening, right? That thinks progress is really big. You know, these are little steps at a time, but really important steps. If you take someone who never had a capacity to really listen to somebody and suddenly they're curious about, in a genuine way, what you have to say, that is progress. If they could start to reflect on what you said, what do you mean there are other ways to think about it? Huh, there are other ways to think about why she didn't return my call. And they start actually thinking about what those other reasons may be. That's progress.
That's big progress, actually.
Mm,
It seems small, but it's huge for
yeah.
someone with NPD to start like reflecting because you're
Yeah,
really getting them to reflect on what happened and the behavior. And then did they do anything to contribute? You might
yeah,
not
well,
say, hey,
that's later. We have to get to that, okay? Because
yeah,
now what you just introduced, and people put the cart before the horse. I
mhm,
see this all the time because I do a lot of supervision of the young therapists who are coming up, in psychoanalytic training.
mhm.
You want to make that big intervention because that's what feels like progress. And
Later.
yeah, that has to come so much later because what happens if they even get the feeling that you think that maybe they contributed to the problem? Like, in other words, well, why didn't she return your text message right away? Well, maybe you called her a nasty, you know, right? But if they get the sense that you're implying that they're responsible, they'll feel blamed and
Mhm,
criticized. And then that wall goes up and maybe they'll even leave. This is one of the reasons people leave.
mhm, mhm.
So, um, so yeah,
I think
so
that also depends on how it's presented to them.
tell me, go ahead.
And that doesn't come until much later.
Yeah.
You know, there's a difference, I think, between and this might be helpful for people listening who want to hear what it sounds like to talk to someone with NPD. There's a difference between, well, you didn't say that the right way. And let me share with you how I think women work. You were
Mm,
talking to your wife, and when you said XYZ, she interpreted it this way because this
mm.
is how women think. It's really pointing out to them, perhaps you didn't say it in the best way without saying those words.
Okay, wait, let's play with your example. I like this. So when you said X, Y, and Z to your wife, this is maybe the way that she was thinking about it, right?
Mhm.
Lisa, that was an example of how you may speak to them. Is that what you were giving an example of?
What I was saying is if I was speaking to someone with NPD and they were talking about an argument they had with their wife,
Uh-huh.
and the person with NPD was the man, and as we know, it can be men, women, anyone, but
Mm,
this is more of what we see, I think.
yeah.
I think I would say to the client, when you called your wife that name, I'm wondering if she interpreted it this way. They're more likely to accept that because
Okay.
it it puts the interpretation on the wife.
Yes.
It's not pointing out that perhaps they could have said it a different way.
Okay.
Not
Okay.
that direct.
So just to have another option at your fingertips. So here is a way that I would think about the same example is I may say, how do you imagine she interpreted that?
Mhm.
So now I'm trying to get them to mentalize. Now this is a
Mhm.
capacity that many people with personality disorders don't have, to
Mhm.
begin to think about how somebody else thinks. So I would ask them, how do you think she interpreted that? And they may say, whatever they say is going to be way off the mark, most likely, because they
Yeah.
don't have that capacity. But
Mhm.
then we want to open that space again for a more nuanced way of thinking about things. And then I would do the same intervention. Is it possible that it could have been perceived in this way when you said it? And just
Mhm.
plant that seed to see how they respond to it, right?
Yeah, I think they're more open to the other person maybe misperceived them,
Oh, of course. Yeah.
and they perhaps could have said it in a different way that was more palatable.
Yeah, because then it's the other person's fault, and they love that, and they'll love you if you put it that way, because now it's like, yeah, she understands me. She thinks that the other person misperceived for
Right,
whatever reason.
right.
Yeah.
So how do you maintain clear therapeutic boundaries with people with NPD? Because I'm sure some of them, especially the grandiose, but even the covert in a different kind of a way, might try to push those boundaries with you.
Oh, okay. So here, I'll give you. Can I do it again by way of example? Like, I love
Okay.
examples.
Yeah.
So a patient comes in, and he looks at his clock, and he looks at his watch. The clock, my clock. And he looks at the clock and he looks at my watch. I mean, his watch. And this goes on for like 30 seconds. And he says, your clock is off. You need to change it. It's off by 20 seconds. Right. So he's pressing on me to adjust my clock to be in sync with his watch. You see what I
Right.
mean?
Good example.
So I say to him, please have a seat. Can we talk about this? So he sits down and I do the same thing I always do. And this is the way I want to get. I don't like the word boundaries, Lisa, just so you know. I think it's overused, and
Mm.
not overused, but used in a way that's not correct. Many people use it like you have to protect yourself from these people. I don't feel threatened, so I don't have to protect myself. Okay, you're shaking your head no. So
Yeah.
let's clarify boundaries then. Like, what's a boundary?
Well, in a therapeutic environment, you're in a session, you're the therapist, they're the client. They're not your friend. They're not your partner. They're not, someone that they buy bagels from.
Okay.
And so you want to make sure if they start to behave, talk, or react in ways that kind of start to put you into a different realm, you're able to reel them back into, in this space and in this relationship. This is who we are to one another without saying those words.
I see what you mean. Okay. So the example I was about to give was one of a patient who tries to push me into a position so that
Mhm.
he can dominate and control me, right?
Mhm,
I
mhm,
have to change my clock.
mhm.
So, but through the act of containment and talking to him, what I begin to discover is that I left him wait. He felt like I left him in the waiting room and he thought I was with another patient and that another patient was more important than him. And that's what we begin to talk about. So I guess I still don't set a boundary, right? Um, I explore. I don't I guess I do set a boundary in a way that I don't jump up and change my clock, you know? Now, if he persists and doesn't want to look at the fact, which he did, because usually if you do this correctly in a soft enough way and slowly begin to unpack it, that he felt abandoned and rejected by me. And that's what we begin to talk about. But if he pressured me to change the clock, or let's say he came back the next session and said, hey, I noticed you didn't change your clock. It's still off by 20 seconds. Then I would say to him, you thought that I was going to change my clock because you told me to change it? And then you see, now I'm getting into the grandiosity, the control, or the manipulation. That just because you think you told me to do something, I'm going to do it. What is that all about? Let's talk. Please sit down. Again, let's sit
Mhm.
down. Let's talk about this. So that would be the way. it's a little different, I think, than what you had in mind, Lisa, in terms of boundaries, like someone is your friend or something, but in a way they are pushing me into a role that I'm not just going to play because someone has pushed me in that direction.
Yeah, it's the same thing. When I say the word boundaries, I don't think it's always verbally or behaviorally so harsh. You can
Mm,
set a boundary with someone in a very subtle way. And
mm,
that's what I'm hearing you say, please sit
yeah,
down, let's talk about this. And I think that's helpful for our listeners who might be interacting with a sibling or someone at work who behaves in this way.
yeah,
They could respond the same way. Hey, let's talk about this.
yes,
I was surprised that you brought up this with the clock and the watch. Can you explain that a little bit more to me?
yeah, yeah.
Yeah.
And the only thing I would add there is I am so happy, or I appreciate that you brought up the clock and you
Oh,
came in
good.
and you timed it. I really appreciate that because once we get into it, Lisa, I don't want this guy sitting outside feeling abandoned and resentful, because this is the kind of stuff in relationships that leads to a fight. You see, and this is where most couples go off and they get sidetracked, because this will lead to a fight, and the focus will be again on the manifest content that he came in and he was angry and he demanded that I clean the house, cook him dinner, change my clock. But if you stop there, this is where you're off, because you're not looking. Remember, I said it's a dynamic interaction. Vulnerability presents with grandiosity. It's not one or the other, it's that rotating iceberg. They're both there. He's acting grandiose and trying to control me because he's sitting out there feeling vulnerable, rejected, and abandoned, that I'm with a patient that's more important than him, but he can't articulate that. And it's much more comfortable to try to bully me around than get into all that crazy stuff. Right? That's
Right, right.
harder to get into. Yeah.
Another thought that I have, another way of thinking about this is if you picture a coin, like a quarter, for those of us watching in the United States, you picture a quarter, you have your heads and your tails. That's kind of what you're talking about here. There's the grandiosity, which might be the heads, but being inquisitive, what's on the other side of that? Let's flip the coin over and look at the other side,
Yeah.
because there's some vulnerability there.
Yes. And the quarter is a good analogy because that's the splitting again. Because if the quarter is on the table, you only see the heads,
Mhm.
right? You don't see the tail, but you know it's there because you're listening to this content and you know that they're there together in this really strange dynamic where they both are present simultaneously, but one is presenting predominantly and the other one is underneath, but it's still there and it's very powerful. Hmm.
Absolutely. I'm sure you've experienced countertransference, and maybe you can explain what that is to our listeners. When working with clients who have NPD, and how do you manage that? How do you kind of react to that, or tease that out if that's what's happening? And this is where the client might attempt to idolize you or manipulate you or devalue you. You just gave us a small example with the clock. Do you have another type of example where they might be idealizing you or devaluing you?
Yeah, so one thing that just pops to my mind, and again, another good question. So thank you for this. And just to sort of tweak it a little bit again for everybody watching or listening, countertransference is if you're in a relationship with somebody and you start to have your own really strong feelings about something that you really can't make sense out of, like you may not even know where they're coming from. And maybe you start treating your partner or your significant other or your mother or whomever in a sadistic or mean way, then there's a countertrans because you wouldn't ordinarily behave this way. That's the whole point of countertransference, right? It's not just who you are, it's being induced somehow in you.
Sorry, my dog came in the room, as you can.
Oh, okay. No worries, no
These
worries.
things that happen while we're making a video, right?
So,
Do you have examples of, can
yeah,
you?
so here's, I'll give a nice one first. Well, it's not nice. None of them are nice because, oh, here, let me just jump into it. So, a patient comes in, and if they start idealizing, like to go along with something you said, idealization is a defense. Now, if the patient is idealizing, like Oh, that was such an insightful comment. Oh, thank you so much. Oh, that's so valuable. Oh, you're so wonderful. You are the best there. You know, my friend has a therapist and his therapist doesn't help this. You get the point, right?
Yes.
Typically, the way that I handle that is I may try to help the patient begin to recognize that I didn't get this from nowhere. In other words, if I use an intervention or I make a comment, that this is a collaborative effort. You see, I'm still always thinking about the therapeutic alliance, something we spoke about earlier, right? Is how do I build an alliance? And one way to not build an alliance with somebody is for them to give you all the power and think you're so wonderful. That's a false relationship. You see that? So, and yeah, and it's a technical relation. It's not really relating. So what I want to begin to question them, and in a curious way, like I always do, is have you noticed that oftentimes you get this feeling like these things, like these brilliant interventions are coming from me and not from you? Like this has nothing to do with you. And slowly, Lisa, what we could do then is get into how they give me all the power. And then what it's like to give me all the power. Because if you're giving all the power and idealizing somebody, that leaves you in guess what? Position. In a devalued position with no power because you've given it all away. So, yes, I have to work with that. And that's the counter transference. But I want to say just one other thing quickly. There is something else that are called enactments, which are often used in the literature synonymously with counter transference. But an enactment is when you actually get pulled into something with somebody and you start acting or really believing like you have all the answers and that you really are rescuing this
Well, that
person. Yeah, go
that
ahead.
that's part of the shared fantasy, wouldn't it be?
Yes,
But not in a romantic way, in
yes,
a different type of a way. They're trying to pull you into this, right?
yes, exactly. That's the shared fantasy that you and I, again, have discussed at great length. We have anyone watching could go back and check that out. But it creates an illusion that it's the two of you together in this blissful, magical relationship. Yes. And that's a very dangerous place to be. So that's an enactment where you actually start playing in, sometimes unknowingly, at least initially. And what you have to do then in terms of how you handle it is once you recognize it, which you should, because you're always reflecting and doing these things on your own as a responsible person or a therapist, then you have to gradually work your way out of it, but you use it nevertheless. It's all what we call grist for the mill. What happened here? You want to understand it then with the patient, and that goes back to what I mentioned just a moment ago, is then to begin talking to them about how they need to see you in this way. And sometimes I may even fall into it, and you have to let them know, don't try to be deceptive, because letting them know that you made a mistake, that's therapeutic as well, because now you become more human to them and you let them, sort of model that it's okay to make mistakes. And look at me, I'm still okay. I'm comfortable. I'm surviving, even though I made a mistake. And I started answering basic questions about your life that I should not have been answering. It's almost like I was telling you how to live your life. And I know that's not good for you. So that's the way I would handle that. Yeah, counter transference and enactments.
This is really helpful, Dr. Mazzella, because I see and read a lot people saying that those with narcissistic personality disorder can't improve or they'll never change. And I think that this is a complex diagnosis, but I think improvements can be made. And I'm sure you'd agree with that as well.
Yeah, like we've been discussing, it's a little bit at a time. Like even things that I see as improvement, like the capacity to have a second person in their life, like to make room for nuanced ways of thinking about things. Mentalization, I mentioned it earlier, and you got it, Lisa, because you were like, no, that is a big deal, right? That really is.
Mm.
But having said that, I don't want to be overly Pollyannish and say like everybody could change, because remember I said they have to have a willingness to recognize that in some way they too are responsible, or at least be curious. Maybe not take responsibility, but at least be curious of, like, the daughter who sends their father to me and says, "You're a narcissist. I want you to go talk to Dr. Mazzella," right? at least to say, what does my daughter see that I'm not seeing? I don't think I'm a narcissist. My best friends, nobody thinks I'm a narcissist, but at least to be curious about what is she seeing. And then we could get close to that experience of how do you talk to her? What's your relationship like? What do you value in the relationship? And he may say, I value it when she admires me. Like some, I'm making that up, but you see, like, then you see if there are signs that there may be these characteristics.
Yeah. Well, Dr. Mazzella, thank you so much. I hope that, you'll come back again, and I hope that we can do another live because I know people enjoyed the last one very much, and
Yes.
it'd be nice if we could follow up on that in the future.
And I think you actually have some things in the last live you mentioned there were some things that we left open that we
Yeah,
need to get back to. So I can't wait to hear what we left open. And I want to add something to the list, okay?
sure.
In terms of healing NPD or being with somebody in your life who has this kind of relationship, Lisa and I, even in this interview, still didn't get to, I don't want to call them higher level, but there are still other ways, believe it or not, that you could talk to your significant other. That if the ways that we've given so far that Lisa and I have spoken about, like the containment, building mentalization, integration, I showed how to begin the process of integration, but there are even, excuse this language, Lisa, higher level interventions. Like when someone seems to be buying into this, there are even other ways we could talk to them that could be even far more powerful for the healing process. So please, let's put that on the list. And if anyone's interested in getting more of these tools and techniques, hopefully they'll come on to our next live where we discuss it in a little more depth. Yes.
Sounds very good. Sorry for the dog nails in the background here, if you could hear them, but,
No,
she likes to be part of the conversation too.
no problem.
All
And
right.
thank you again, Lisa, so much for having me on again. And I hope I did an okay job. I tried to answer your questions, and I think we maybe hopefully we made a dent in that.
Very, very helpful. Thank you, Dr. Mazzella.
You're welcome.
Take
Bye.
care.
Okay. Bye.